welcome to our call for the 21st of July, 2022. Months just run by, indeed. So we have a lot to talk about today. I want to dive right into things. We're continuing study management, and we're going to be talking more about the sponsor-related duties as we move on. As I mentioned in last week, that the CRO, if they have been delegated those responsibilities, then they will have to put all the systems and structures in place, and then the sponsor maintains oversight. We're going to talk about subjective control according to Neville Goddard. So medical expertise, right? So we have to make sure that the sponsor has appropriately qualified medical personnel who are available to advise on trial medical questions or problems. Every trial has a medical monitor. Now they have different names: medical monitor, clinical physician, clinical scientist. There's so many names, but the bottom line is that they have to be there to work with the principal investigators, right? Peer to peer, okay, to ensure that all these trial-related medical decisions are taken care of. And then they have to have also qualified individuals. So we have medical expertise for the trial design. You have biostatistician, clinical pharmacologists, you have physicians. And basically, you want to make sure that in addition to clinical operations, you have high-level personnel who have that area of expertise, right? That they're niched to provide their experience and their expertise for all the clinical trial reports and all the clinical trial related material, and that they can analyze this data based on their education and their experience. And then, of course, they talk about, for further guidance, we're looking at a clinical trial protocol. This is the trial design, the structure, the content of the clinical study reports, and how every single trial procedure is actually put together. Trial management, data handling, and record keeping. We discussed this before. This qualified individual have to supervise that. That's what we do in clinical operations. All the people we're talking about are part of clinical operations because we're conducting it. We're doing a statistical analysis. We're preparing trial reports, right? The output from all the input. So we've put the input at all these things. The data has been collected, and now what is the output is all these reports, that we're going to be using to analyze and also to submit. An IDMC, which is just an independent data monitoring committee, they do, there are many trials, particularly in oncology, and then also in trials where if it's usually the early stage of the trial, maybe it's an orphan drug. I mean, what that just means is that if it's one of those trials, many smaller companies tend to establish these committees quickly because they review as soon as data starts coming in. Those are those trials that the protocol keeps getting changed, right, to make sure that we're analyzing properly. So those committees will look at the data, but also for clinical trials that are massive and there's a lot of safety concerns, right? They also establish the data monitoring boards, and their role really is to look at the data, critical efficacy endpoints at intervals, and then they make a recommendation to the sponsor on how they can modify, they can continue, or they can stop the trial. They have written operating procedures. Some are called steering committees in some cases. I mean, they have so many different names based on the type of clinical trial, but that's really what their role is. It could be on a small trial that's just, hitting humans, and maybe a smaller company, and they need this as quickly as possible. And so those meetings occur often, or it could be on a very large scale trial, massive sponsor. And this committee means maybe quarterly or periodically to take a look at what is happening from the data, and then they publish their reports. We've discussed this before, right? We want to make sure that, we have systems in place that have established guidelines for completeness, accuracy, reliability, consistent intended performance, systems that are validated, and that were systems that have been created and taking into account of risk assessment. And that way, whatever we are researching, whatever data that is coming out of it It's those quality checks, there's risk assessment, right? And that way we ensure that our patients are safe. Then there is also SOPs, okay? Maintaining SOPs, the norm in clinical and the clinical trial industries, there's all kinds of SOPs. I mean, there are cases where you might start on a project, you have over 300 of them to read. But we want to make sure that when using these systems of data recording and keeping, that they are validated. There's a change control mechanism, there's system maintenance for, there's risk analyzed for secure, for outtakes. The data has to be backed up. We have to be able to recover it. There has to be contingency planning as well, right? And there has to be a method for decommissioning. So let's give an example. Let's say we're using a database to manage our investigational drug product. There have to be SOPs as to how we're using that database, who's using it, and there has to be an audit trail as to the activities that are taking place, right? And then if people do not use it anymore, maybe they resign or they stop working on that project, there has to be a system for ensuring that they are deactivated within the system. We have to make sure it's a validated system, right? There are checks in place, right? Because it's one thing to capture data, but if you're capturing data into something that has issues, has bugs and problems in them, then how do you know that your data is actually reliable? Okay. And of course, this also refers to any other vendors that the sponsor is using. We are making sure that these systems are designed to permit data changes, right? I just talked about that. Maintain an audit trail, an edit trail, a data trail, security systems that prevent unauthorized access to the data via the clinical research site. And you're giving, your username and password. You can't have anybody else logging using your username and password. Now, we have to maintain a list of individuals who are authorized to make these data changes. We have to have adequate backup of the data. We have to make sure that if we're in a blinding case where nobody's aware of what study assignment that a patient is getting, then it has to be incorporated into the system. Data integrity is huge, huge, huge. And that when you're making changes to computerized systems, software upgrades, or migration of data, we have to take all of this into account. And the ICH GCPs were actually revised to take all of this into this iteration of the ICH GCPs was really about the changes that were happening in clinical trials. When I started in this industry, it was all paper collection and paper and everything. But now everything is online. And that's why studies have just gone worldwide. There are thousands of studies being done just because now anyone, anywhere in the world can log into a system and be able to be part of a clinical trial. And that's fantastic. We want to make sure that the data is not transformed during processing, right? Just simple things. We want to make sure that, the subject identification code, we have to use it for patients, and that is to maintain confidentiality. Even when we receive documents from a site, whether it's medical records, we have to de-identify them. The site has to. We don't want to know people's names, their birth date and all of that stuff. We just have to identify the patients by a code. And the sponsor has to know the owners of this data, how long that they're supposed to be retained. Okay. And in terms of essential documents, that is the case. We're talking about data, anything, essential documents is the same thing. We have to maintain them. There have to be systems in place. And then if the sponsor discontinues the investigational product, or, right, if it chooses, then there has to be at least 2 years that this essential documents have to be kept, or the data that is being recorded, that has to be kept, right, in such a way that there's always access. This 2-year period doesn't matter because all the things related to a clinical trial are just kept for a really long time. Okay. And then, of course, we talk about if the sponsor discontinues it, the clinical trial, right, everybody has to be notified, and then the appropriate steps that are going to be taken to ensure that the data, nobody has access to that data, right? If it's stopped, then all the users have to be taken out of the system. And then, of course, if there's transfer of ownership of any data, then you have to follow applicable regulations. Okay, then there's the whole thing about when the timelines for retaining essential documents. So just 2 years after the last approved marketing application. And in the ICH region, at least 2 years have elapsed since the formal discontinuation. It's always 2 years. If the product has been approved 2 years after, you don't need to keep it. And then if it's not, then you still have to keep it for 2 years. But honestly, like I said, these things are just kept for a really long time. And that's it. So just ad hoc things about data and record keeping. We're really just wanting to make sure that, we have systems in place, things are processed properly. If there are essential documents, those things are actually retained. Okay, so let's talk about subjective control. Nice segue. Subjective control of clinical trials, right? If we maintain great checks in the clinical trials, then we have subjective control. If we do not, then things go to an objective level where we don't have any control anymore. So never goes back to your imagination. There's one thing about never, who's the king of imagination. Your imagination is able to do all that you ask in proportion to the degree of your attention. All progress, all fulfillment of desire depend upon the control and concentration of your attention. Your attention is directed from within when you deliberately choose what you will be preoccupied with mentally. All the previous weeks, that's what we talk about. Your attention, what you're preoccupied with in your mind, that's what will determine your reality. And he says there's an enormous difference between attention directed objectively and attention directed subjectively. And the capacity to change your future depends on the latter. Subjective control is the ability to have an idea and take that idea and have it subjective to your experience, where you think about it, you visualize it, you implement the ideas that are coming forward, right? You take inspired action. Something comes or you say, oh, I gotta move forward with this thing. You do it over and over and over. So you're taking something from the objective to the subjective. And I talk about in many of my YouTube lectures about things move from internal to external. That's the rotation, right? So the external is the objective, internal is the subjective. So you're taking things from there, some concept out there, I want to be this person. And it seems so far-fetched, but you think about it over and over and over and over again. You're so obsessed with it. Then it starts becoming normal. And then before you know it, ideas start coming forth, and then you implement those ideas, and then you become that thing. That is the key right there. When you are able to control the movements of your attention in the subjective world, you can modify or alter your life as you please. But this control cannot be achieved if you allow your attention to be attracted constantly from without. Again, the control is inside. And it's that closing my eyes, imagining it, implementing what comes through, right? So it's all in here. If you're constantly pulled by what is happening out here, you'll never achieve anything, because out here, there's all the evidence that nothing is moving. But in here, that's where it's possible. Each day, set yourself the task of deliberately withdrawing your attention from the objective one, focusing it subjectively. Remember, there is the external world. I withdraw to my internal world where I have control. That's what subjective control is. Objective, there's no objective control, because in the external world, you have no control out there. Things have already coalesced, they're already out there. You're living with the physical world, but in here, you have control. You have control of what you're going to focus on and what you're going to think about. And that is the true power here. The day you achieve control of the movements of your attention in the subjective world, you're master of your fate. That's it. Master of my fate means I have come to the point where no matter what's happening in my external world, the world in me is the real world. I don't care. I'm not pulled by the winds of change, by all the constant movements in this objective world, because I know that within me, that's the real world, because everything starts from there. So he says, you will no longer accept the dominance of outside conditions or circumstances. You will not accept life on the basis of the world without. So when you focus on have subjective control, the external world slowly fades away. You live in it, but you know that it is but the coalescing of past things that have happened. They've condensed, right? And I say, like in the Yoga Sutras, prakti, matter, it comes from the ideas you've had, and then they become form and experience. And so if you want to bring forth a new world, you have to go back to the internal world constantly and keep thinking about it and imagining it, and that will come forth in your life. So isn't that wonderful? We talked about data and record keeping and managing of essential documents. Those are all things that have coalesced. They've become external, right? And so we had an internal process for creating all the processes that manage data, and then we've brought it out in the world, and it's the same thing, right? Subjective control. I only have control of my internal self. And so what is my role? focusing on what is internal. And there are things going on in your life that you like, then that's wonderful, right? So you're going to enjoy them. But if there are things going on that you don't care for, go back within and recreate what you want. Go back to your subjective control, where the only power you have lies. That's the only power you have in the world, that subjective control. And again, these are my ideas, these are my thoughts. I like to talk about clinical trials and talk about these concepts, because if I talk about clinical trials all the time, then your brain becomes foggy, right? You're like, oh my God. But then when you hear this concept is a higher vibration. And so your chances of you comprehending what is happening in clinical trials increases. This is a testimonial for what happened to me. So I appreciate you. Enjoy this. I look forward to seeing you guys doing the weekly coaching calls and on our platforms. Please like, share what we're doing. We're growing, but it is you who makes all of this possible. Okay. I will chat with you next week. Bye-bye.